Hi everyone, this is Dr. Abhilash, GI and laparoscopic surgeon, and I'm here in this video to talk about appendicitis. And because it is also another common problem which anybody can face, and it can affect all age groups, no matter from a child to the elderly people. Anybody can suffer with appendicitis. So first thing is, I think many people have a doubt, what is this appendix, what is the function of the appendix. And it is a small tubular structure which lies inside your right side of the abdomen, where your small intestine and large intestine are meeting. Okay, and we call this as a vestigial organ because it does not have any function. This appendix just secretes some amount of mucus which goes into your intestine, but otherwise as such it does not have any function. In appendicitis, the commonest cause could be a fecalith. A fecalith means a small particle from your stools which can go and block the mouth of the appendix, leading on to inflammation. The contents inside are blocked, and they undergo an infection and followed by an inflammation, causing this appendix to give you a problem. The second possible reason could be a lymph node. Lymph nodes are in large quantities are present around the base of the appendix in that particular area. So a gut infection can lead to the enlargement of these lymph nodes, which can block the neck of the appendix from the outside, extraluminal obstruction, leading on to appendicitis. Other rare causes could include a worm infestation or a tumor inside your large intestine, which are usually not seen. The commonest symptom is a pain which is present around your umbilicus initially, which can later radiate to your right side lower abdomen. Okay, this region is called as McBurney's point. So the typical pain present at the McBurney's point could be in favor of appendicitis. There can also be other symptoms like vomiting, and some people can have fever, and some people can also have loose stools. Most of the time, diagnosis is clinical. We examine the patient and we will be usually able to tell them whether it's an appendicitis or not. And whenever you suspect appendicitis, the first thing we'll ask for is an ultrasound scan of your abdomen, and also the WBC counts, which might be elevated in an acute appendicitis. Ultrasound scan might not be able to pick up appendicitis in more than 50% of the patients because of the location of the appendix, which is difficult to identify on an ultrasound abdomen. So a confirmation can be done by a CT scan, that too especially with a contrast, which can easily diagnose your appendicitis, which has got 100% sensitivity. People have a doubt whether you can manage appendicitis with medicines. Yes, we can manage appendicitis with medicines. Medical management is usually not the preferred choice of treatment, because even if the appendicitis settles down with your medicines, there is a high possibility that it can keep recurring again and again in future. So the permanent solution for appendicitis is going to be a surgery, and that too, which is ideally done within 48 hours of the onset of symptoms, will be the best treatment option for appendicitis. So this surgery is usually done by laparoscopy, and timely intervention, when it is not done, it can lead on to complications. The complications in appendicitis, when you don't go for the surgery on time and you don't seek medical attention, what happens is this appendix can perforate. It can rupture and cause spillage of the contents into the abdomen, causing pus and forming an abscess. There is also another form of appendicitis. We call this as subacute appendicitis, because many people, when they go to the physicians or go to a general doctor, they don't get treated by surgery straight away. So sometimes they might have responded to the antibiotics, but when they present for the second time or the third time with appendicitis, we call it as subacute appendicitis, which is not very severe, and the complications are also less common in these patients. But definitely the permanent solution is offered only by surgery, that too especially laparoscopic surgery, where you can get the surgery done and get back to home within a day, and maximum get back to your work within a few days time. I think by now you must have got a rough idea about how this appendicitis is treated, and if you have any further queries, you can leave your comments, and we'll see in the next video. Thank you.